beforehand, I'm the design and brand manager for the North Carolina Partnership for Children. We'd really like to thank you for attending the virtual conference today. We're sorry we're not able to host the in-person version, but I think we're really excited about what's going on here and thankful for the opportunity to share this with the network virtually. Like Scott said before we begin, just try to make sure your microphone is muted. There are a lot of us on today. If you have any questions, feel free to post them in the chat window. They will, because there are so many of us and Aviva's presentation is so good and packed full of information, we're going to collect the questions at the end and she is going to answer them via email, I believe. Correct me if that's not right, Aviva. But without any further ado, I'm going to post a link in the chat to today's presentation. There's a PDF of the slides that I am posting now. And without any further ado, I'd like to introduce Aviva Starr with Go NAPSACC for her virtual conference presentation. Please, I will mute and please take it away, Aviva.
Wonderful. Thank you, Scott and Eric. Good morning, everyone. Welcome to the Smart Start Conference. As one who's been attending Smart Start conferences for many, many years, this is certainly a different way of doing this. So I appreciate you all joining me first thing in the morning. Today, we're going to talk about how Go NAPSACC helps childcare programs increase children's healthy habits. Certainly an important topic at any time, and I think right now an especially relevant topic to think about the role of childcare in setting children up for long-term health. We have a lot to cover since originally this was supposed to be an hour and a half long, so I am going to ask people to put questions in chat. Eric can share any that seem especially relevant at the moment, but otherwise I will respond to everyone afterwards. I look forward to hearing your questions and continuing to support you in this work. I am a training and outreach coordinator with Go NAPSACC. I've been here a little bit over a year. In that role, I support programs across the country. Go NAPSACC works in over 20 states, so work with many different states and many different uses. Previous to this, I was project manager of a early childhood mental health consultation project in Durham, North Carolina. So I have many years doing TA work directly with childcare providers and supporting childcare providers around children's social emotional health and now their physical health, which we of course continue to learn are more and more interrelated. Today I am going to give a review of Go NAPSACC. So if you have experience working with Go NAPSACC, then this material probably will be things you already know, but I thank you for joining us and you get to decide how long you want to stay. But this is really a way to give an overview to those who might be new to Go NAPSACC. So after I give a little bit of an overview, I demonstrate tools, talk some about different types of implementations, some that are happening here in North Carolina and some that are happening other places, but different ways that Go NAPSACC can help you in your work, a teeny bit about evaluation data, and then certainly next steps who want to get involved more. So with that, I get started. So every day we work to help ensure that children are cared for in environments that help them thrive and build a strong foundation for future success. While Go NAPSACC is focused on the health and physical development realm of children's development each is important for their overall well-being. They're certainly interconnected, and the focus on all is an important factor for ECE professionals development of the whole child. We know that by spending our efforts focusing on the health and physical well-being of children and their development, we also impact their other realms at the same time. Go NAPSACC was designed to help childcare providers make improvements in their environments that would foster the adoption of healthy eating and physical activity habits in children. The program was started in 2002 here in North Carolina, working specifically with childcare health and has grown since then. It was developed in a collaborative effort between researchers, public health professionals, and technical consultants, just like many of you today, and certainly childcare providers were also involved along the way. Go NAPSACC works to bring together the most current research on what is best for children, along with that which is feasible for childcare providers to put in place. Evaluation results have shown repeatedly this program is effective in helping childcare programs make healthy changes and improving children's health, behaviors, and weight. As I mentioned, it's used across the United States. It was the basis for other programs such as Let's Move Childcare. In 2014, Go NAPSACC went online, offering an easy-to-use tool for childcare providers that continue to support the adaptation of these practices. Go NAPSACC is free and unlimited in any state with a Go NAPSACC contract. So for example, here in North Carolina, it is unlimited use by TA consultants and unlimited use by childcare providers. So as many people as want to be enrolled and registered and take part, we're here to serve you. And it's my job, as I said, as the training and outreach coordinator for North Carolina to provide that support in North Carolina. Go NAPSACC's program is based around a set of best practices. These best practices were developed through this scientific process, bringing the evidence in the field. They represent our available knowledge about how childcare providers can support the development of healthy behaviors in children. Having best practices as the heart of this program, childcare providers are always moving in the right direction, regardless of what they are working on. So here, see in the center, the heart, there are 7 modules of Go NAPSACC. They are each by their own color and icon: child nutrition, breastfeeding and infant feeding, farm to ECE, oral health, infant and child physical activity, outdoor play and learning, and screen time. Together they form what is the best practices for children's health, but they also give the ability for childcare providers to choose where to start. We would never ask any program to look at all 7 modules at once. That would be overwhelming. But either for you, perhaps as a technical, as a TA provider, perhaps you're focusing in one area, breastfeeding, child nutrition, farm to, or perhaps your childcare programs get the opportunity to choose the place where they want to start, a place where they have the greatest interest, a place where they're already strong and they want to get stronger, or a place where they need to know they need to work more. But they get to enter, and you get to have that wherever they enter, they choose will be children get help. Give you an example of the best practices. I'm choosing child nutrition as the module for us to look at. Each best practice within each module, 4 areas of best practices. They start off with what's to children. We call them the 4 Ps. So provisions, what's provided to children. That involves in child nutrition things like food and beverages provided and the feeding environment. Examples are here. Fruit, not juice, is offered 2 times per day or more, and television and videos are never on during snack times. Next, we move on to the practices. We think of those as the practices of the adults that support the children's development. So here we look at the feeding practice, and then also the menus and variety that's offered and what they eat. For examples, teachers always praise children for trying new or less preferred foods, and weekly menus always include a variety of healthy foods. Obviously, for each module, these types of best practices will be different. For screen time, what's provided to children has to do with their access to screen time. In physical activity, it has to do with the equipment provided to children as well as the amount of time provided to them to be active. However, in all of the modules, we end with 2 areas. One is professional development, our next P, and that's education and professional development. So that includes the education of staff, what they know about this topic and how they help share it with their children, but also the education of the families in your program as well as the children in your program. And the last P is always policy. We want to make sure we take the changes we make and make them permanent. So that's by including them in our policies, our books, our teacher manuals, all of our staff and families know the expectations of our program, and that as staff might change, new staff, new families always know what this program is representing, what your childcare program is offering their community. So that's the heart of our model. On the outside is that change process, right? It's not just knowing that makes us change. It takes all of us time to really make those information become habits. And this is what this is about. It's about developing healthy habits. So to help childcare providers reach these best practices, Go NAPSACC offers tools that guide childcare providers through a 5-step improvement process. These are the steps needed to create and maintain It's exactly what you already do if you're a TA. It's what you do to people, but it's giving you that process to help you move through. It's arranged as a framework to help you understand where childcare process and how you can support them next. So those 5 steps are here. You see them with 1, to assess. So to look at where you are currently as a childcare provider in any of these modules. Currently do honest assessment of where you are so you can see where you want to go. Next, you make a plan. And Go NAPSACC, as I'll show you in a minute, has a process to help you with that action planning. There's already sample started action plans, which then the provider adds and edits to make personal for them. There's that take action when you start to put things into action and you gain information from your community, from your families about what else they need to move forward. There's learn more. In Go NAPSACC, there's a whole wealth of information, tips and materials, some trainings, which I will show you in a moment, as well as obviously the support of your community. For those of you who are on the line who are TA providers, you know lots about the other training and options in your community to help people learn more. Then what made these changes, we want it to be permanent, as we talked about. So here we got step 5, which is the keep it up stage. That's when programs think about, how do I make this permanent? How will I make sure that this change I made now becomes part of my program's habits? And one way we do that is by retaking that same self-assessment. So if we started in child nutrition, we started with our self-assessment, we take it again. That's how a childcare program can see the changes they've made, and how, to be honest, those in the evaluation world, in the funding world, can see the changes that have happened in your program as well. So we certainly want you to take that again so that a program can celebrate their successes and perhaps see where they want to go next. Our improvement is a circle so that they can then re-engage. They could go back and again choose to set new goals in child nutrition, or perhaps it's time for them to move on to a new module and look at a new. So that's the overview of Go NAPSACC. I appreciate the question in the chat. I ask others adding them in, and I will certainly respond to everyone over the next week as well, so that once the tape of this is ready to be shared, I can also share the answers to all your questions. So please add more. So let's look at what Go NAPSACC looks like. As I said, it's and I have prepared for you a pretend, we have a demo site, so a pretend provider who's done some work in Go NAPSACC. As you can see here on the left, there are the 7 modules of Go NAPSACC with those icons I mentioned. Each module where a childcare provider has already taken a self-assessment, they see overall here how they're doing. So they're strong in child nutrition, they're already leading the way. Well, as you can see, they have some more work to do, perhaps in breastfeeding and infant and child physical activity. And they haven't yet taken the self-assessments in these other areas. But this gives them a little bit of an overview of where they are already. This is on their My NAPSACC page of their website. As they move down that page, there's a file folder system, is how we think of it, of each of those modules, with the 5 steps outlined behind them to keep on moving through that process. So here in breastfeeding, you can see they've taken a self-assessment because I can view their results. And we saw up here that they had taken a self-assessment, but they haven't yet moved through as much. They've set 1 action plan. But let me show you first what the self-assessments look like. So I've started a self-assessment in child nutrition so that we can get a picture of what that looks like. It starts off with just questions for them to answer. Questions about those 4 areas that I mentioned before: what's provided to children, the teacher practices, the education and professional development, and then policy. For each of those questions, such as how often does your program offer fruit, not including juice, in general, there's an option of 4 answers for them to choose from. They can print the self-assessment if they want in advance, and that way they can get the input of others. Perhaps they're not sure, perhaps the director is completing this and she wants to go with the cook about what's being served to children every day. Certainly when we get to things like practices, we want to talk to and watch what our staff is doing at lunchtime, how they talk to children at mealtime, what kind of education is happening in their programs. So they can print this out in advance. A few other things to know about the assessments. These are tailored to the program. So when a program initially Go NAPSACC, they answer questions about, are they a child care center or a child care home? Do they serve infants, toddlers, preschoolers? Do they provide food, or do children bring their own food? And then these questions are tailored for them. So some of the best practices are different for family child care homes than they are for centers, as well as in this example where there's foods provided. If the children bring their own foods, then they aren't asked questions about foods provided. They're still asked all the questions about practices, education, and policy, even if you don't serve the food that even if you don't prepare the actual food that children eat, you still have many ways that as a child care program you can influence children's nutrition and understanding of nutrition. So you continue to answer questions. Each time you hit continue, Go NAPSACC saves the work the child care provider. So we know that child care providers are very busy, and it's a job where you often get interrupted. So know that each time you hit that continue page, it will save, and they can come back to it later and hit that button as I do where it said finish your self-assessment. A few other things I want to show you as we move through the questions. You will see that some questions are underlined. Question that's underlined, you simply hover over that and a definition appears. Perhaps it's a phrase, as in this case, authoritative feeding style, that may be something that a child care provider isn't familiar with. So here it says an authoritative feeding style strikes a balance between encouraging children to eat healthy foods and allowing children to make their own food choices. A teacher might encourage a child to eat broccoli by reasoning with him or her about its taste and benefits instead of using bribes. So that's what we want. It's authoritative feeding style. Often child care providers see that word and think authoritarian, which they know is bad, compared to authoritative, which is that balance between encouraging children make the final decision about what they want to eat. That's probably the most complicated question in all of Go NAPSACC. So I show it to you so you see it, but not to scare you. In general, the questions are quite straightforward, but perhaps someone doesn't know exactly what Go NAPSACC means about that question. We continue to go through, answer questions about menus and variety that I mentioned before, information about education and development. Go defines professional development very broadly, just so people know it's not always formal training. It could be information you share with teachers. It could be websites that might be helpful for them to use in learning and other types of things. So very broadly is defined, as well as education of families is also a very broad definition, including sharing information with families that they might find helpful. As you hit continue, the last question in every Go NAPSACC self-assessment is about policy. Does your program have a written policy, in this case, on child nutrition? If you're in no, you're done. If you say yes, then there is a drop menu that asks you more specifically about the pieces of your child nutrition policy. So that's what the self-assessment looks like. As we said, we want child care providers to fill this out honestly. This is not a test. This is not a part of licensing. This is about getting an honest self-assessment about where you are. Just as for any of us, if I wanted to change my habits around physical activity, I have to be honest about how often I'm physically active now so I can set goals for the future. Within Go NAPSACC, those goals are done through action planning. So once a child care provider makes their self-assessment, they're able to view their results. I'm going to show you those here in breastfeeding and infant feeding, since in child nutrition, as you saw, I still have an self-assessment, so we can't see our results there. But here in breastfeeding and infant feeding, I can see my results in any of those sections. And I'm shown first places where I've already met the best practice, what we're striving for. I also see the places where I have not yet met my best practices. I see as a child care provider how I answered the question and then what the best practice is. So those are never hidden from child care providers. We want them to see what we're striving for and get a chance to work towards those goals. Once I take it, assessment, I move on to action planning. I've already written a couple action plans, so I'll show a sample of one of those now. So within my action plan, Go NAPSACC starts with a pre-population plan I mentioned to you before. So here's the goal I'm working on. In this case, it's drinking water is always visible and freely available to children, both indoors and outdoors. There's an action plan that gets me started, but it's able to be edited. I can edit any of my notes. In this case, I added that we're going to have a staff meeting next Monday to discuss new strategies. So there's a goal about there's a step about sharing this goal with teachers, and I already have a plan that we're going to do at our staff meeting, which apparently was way back last October when I first wrote this goal. If for some reason, one of the steps isn't significant to me as a program, I can delete it by clicking this X. I can add a step if there's something else I need to do, and I can also move the order of my steps, by just clicking here with my hand, and then I can move the order. So we want childcare programs to make this personal to them. As I said before, it's one thing to set a goal. It's another thing to really think through, how am I going to make this come into fruition? And so we want you to personally think about your program and what your program needs. Go NAPSACC also gives a sample date of when we think this action plan could be completed, but we certainly ask you to take in consideration any other breaks that are happening. Certainly in this time of a child care program was goals, they could think about where they want to go, but it would take a while before they could actually, and that's okay. Here's where you save your plan, and then it changes into this where we can check off, complete them, so we can also have a guide to mark us through. You can see here on the bottom, I can print my action plan. I also, once I've completed and I've done it, we now have water visible for children throughout the day to take as they need. We want childcare programs to mark that they reach this. That's a step that people often forget, but we want it there so people know I reached this goal, and so that you as a TA provider or your funder or your local partnership also knows the goals that people have put into action. It can take me directly to the related tips and materials. So let me show you what it's like. If I click on it here for my action plan, remember we were talking about having visible and working with beverages, I'm taken to the piece of the tips section of Go NAPSACC that's related specifically healthy drinks for children. I also have classroom activities that I download and pieces also on family engagement of how I can educate my families more about this important best practice that I'm working on. If it's available in Spanish, you can click on the Spanish version here compared to the English version, which is here. There's also a way to search through Go NAPSACC, so I could search water if I wanted and be able to find all the things related to water. What happens if I start with action planning? Also can see the complete Go NAPSACC library by clicking here on the materials. From there, there's a drop-down menu with tips and materials related to all those different things we talked about. So just like we saw in our child nutrition self-assessment, there's foods provided, beverages provided, the feeding environment. I can go through all those as I showed you and be able to select select tips and materials that will help me bring that goal into fruition. The Go NAPSACC best material chosen to match the best practices. So you can feel confident as a TA provider that everything that a child care provider download tips and materials will support their best practices. These are all downloaded. They are not taking a provider to a website where they might start clicking and go other places. Downloaded straight here for use. They can also mark things as favorites to come back to them later. I also wanted to show you that we have a training page. Currently 2 trainings here. One is on supporting healthy eating with Go NAPSACC and CFC. The other is on supporting physical activity and education. By the end of the year, Go NAPSACC trainings on each of the 7 modules. Those are in production quite busily right now during this a little bit slower time. We wish they were there for people to be viewing now, but they will be there by the end of the year. That will be more extensive library. In addition to having trainings on all 7 modules, they will be broken into those same subcategories. So there will be a training specifically on foods provided to children. There'll be a training specifically on teachers' practices around child nutrition. Teachers can take those independently and will receive a certificate when they finish, or they could be used within a staff meeting or within a TA training. So we hope you'll come back and look for those later. Next, there is a My Account page where a provider can see the answers to all those questions I mentioned before about their program, so that their self-assessments will be tailored for. And lastly, there is a help box. And we do have a help desk that is available during business, as well as an email where anyone can email with questions. There's a how-to guide that a provider can download, and I actually didn't show you that on each of the pages there is a how-to video that would tell them specifically about that step of the improvement process. So in this case, we're on step 1, self-assessment, and there is a how-to video to help childcare providers, along with the space where they can print their self-assessment. So that shows people provider accounts. I'm going to show people to what the TA account looks like. And I do encourage anyone to write any questions. I can come back and answer those later for you. So for those of you who are on the line who are TAs, this is what the TA account looks like in Go NAPSACC. It's showing programs you're connected to, being connected to programs, to being connecting to someone through social media. It shows you how many children those programs serve. That's based upon what the childcare provider answered in their registration. And then here you get a basic snapshot of the programs that you are connected with. So you get to see when they connected, what their last self-assessment was, and what their most recent action planning was. If I click on that provider, I get to see TA exactly what the provider sees. So this is a different sample account, but I get to see here all the work this person's done in so many different areas. I also get to see their action plans. So I can see the action plans that they're working on. It's grayed out. That means they've clicked on those steps and they've already completed those steps. So I get to see exactly where they are. As I said, you get to see, to view it. As a TA provider, you cannot enter the best practice, enter the self-assessment questions, nor can you complete an action plan. But you can view the work. You could be on the phone talking with a provider about the work that they're doing, work with them together as they update their action plan, and have those conversations virtually. So if you're going to go do a visit, you can first check in and see where they are. You could view the results of their self-assessment and see where they might want to work on next. So it's a way for you to more easily see their progress and to support them, whether that be in person or in this time remotely. To connect to new providers, that's available to you here on your connections page. You can search for them to see if they already have an account. Multiple TAs can work with the same program either over time or at the same time, and that way those different TAs will be able to see the work that the other TAs are supporting as well. If a program is new to Go NAPSACC, you invite them down here just with their name and email address. Next on your TA account, there is a resources pages. For those of you who've used Go NAPSACC before, brand new, so I'm excited to show it to you here. It supports TAs through all the phases of Go NAPSACC work: enrollment, orientation, and then those 5 steps: assess, plan, action, learn more, it up. There are folders available to you here for each of those stages. So starting off with, why is this stage important? It includes some extra tips, and in some cases, quote providers and consultants who have used Go NAPSACC. There's each of the activities of this stage. So right now we're talking about enrolling new people. So we wanted to promotional materials to let people know. You can click on these and there's more information there, including any helpful hints. From there, we move on to common challenges and solutions. So for you as a TA, you can get answers to common questions and hopefully be able to troubleshoot for providers along the way. And then last, there are supporting documents. As you can see, many of these are listed as coming soon. As I said, this is brand new. Let me show you in a different area where there's already some tools there that you can download directly. So all of those supporting documents are still are written, but they are being updated to be website friendly. So those will be going up soon. So that is happening very soon. Someone about working with families in their homes. I just want to be clear that Go NAPSACC is about supporting childcare providers. So this is a program that is supporting facilities, childcare programs, working with Go NAPSACC. So while families, childcare providers can share the tips and meant for families, are all working directly with childcare providers. So that shows you a little bit about the consultant resources. We hope that will really support TAs in doing this work and be able to see more common challenges that other people have had and hopefully circumvent those and to go, or when challenges come up, as we all do have challenges, finding answers here. We're excited to share that with all of you, our consultants. Consultants also have access to those tips and materials so that they can find things that will support their providers in doing their work. And then they also have a reporting section, and I'm going to show you reports in a second. But for TA, you can pull reports specifically on the programs that you are working with. So only on those that are connected to you. It gives you a chance to see how a large group of your providers are doing. So when you look on your My Programs page, you can look in depth provider and the work they're doing, what self-assessments they've completed, what action plans they've written. Here through your reports, you could see across a year or across a group what work they've done, and you can do that through reports. So that shows you a little bit about Go NAPSACC. I do appreciate questions and ask people to continue to add them to the chat that I'd come back to. Very quick demo of Go NAPSACC. So know that if you chose to participate as a provider, then your TA would support you through this work and help you get more comfortable using Go NAPSACC. And if you're a TA, you would go through a training before you get started, and I'll tell you more about that at the end. So I just wanted to give you a little bit of a view of what Go NAPSACC looks like. Third kind of account, I've showed you a provider account and a TA account. The third type of account that Go NAPSACC is called a state partner account, and that is for those people who are involved more at the evaluation level. And so I'm not going to show you that today, but that is available where if you had a state partner account in North Carolina, you would be able to see the data on all the child care programs that are involved in Go NAPSACC in North Carolina. So with that, I'm going to take a drink of water and then a little bit about the implementation models of Go NAPSACC. There are many ways in which Go NAPSACC is being used in North Carolina, but as I mentioned, Go NAPSACC is throughout the country and actually at this moment, 23 different states. So I want to talk to you a little bit about the different ways it can be implemented to help kind of maybe help you think differently about how you might be able to use Go NAPSACC with local partnership, health department, or other places. So let's start with statewide technical assistance networks. We believe Go NAPSACC is helpful for those who are working on this area of health promotion and increased nutrition and physical activity for our young children. It standardized the expertise among existing TA networks. So for all TAs using Go NAPSACC, or all TAs supporting these areas across the state, they know that Go NAPSACC provides them the most recent best practices. So they'll have access to what we know is best for our young children in child through using Go NAPSACC. It also gives us know where do we have TAs who are supporting this work and where do we need more TAs. So it gives us a way to help address and assess where more need is needed. So let's talk a little bit about how TAs might do this work. It can look differently in many places. So first, what we have, rolling TA. Rolling TA is that you as a TA are available, and as perhaps as program are interested, or perhaps you have a set number of programs you can work with. You can work with 10 programs at a time. As one finishes a module, maybe you program. So that we call rolling TA. It's just ongoing work with providers along the way. Keep in mind that our TAs could be TAs who more traditionally work with childcare programs, such as those who are employed by local partnerships, those who are employed by our resource and referral agencies through childcare. But we also have TAs across the country in many different types of agencies. So I'm working currently in Arizona, where SNAP-Ed is training all of their local agencies to use Go NAPSACC as part of their work. Connecticut work with a group that specifically is a resource and referral agency only for family childcare homes, and they're using Go NAPSACC. In this work, they are training all their community health educators in Go NAPSACC, so that if part of their local health department's plan is to support ECE providers to support childcare, then their health educators will be ready to do that. So we want you to think widely about the people whom this might be a benefit. A different type of providing TA is thinking about various intensity. So I think we traditionally think of TA as someone who visits a program, is on site, and helps. That might be the most model. Do one-on-one visits with people. Perhaps we as the TA actually train the providers on the topics. That's very intense. There's also different levels. Within the consultant resources that I showed you and in training, we talk about if you can only visit sometimes, where are the more important places to make your in-person visits compared to those that you could do more phone remote support. And in some cases, we have TA happening for Go NAP. It is completely remote. It's all support through phone, email, and encouragement in that way. So just to think about that, TA can have various intensity. That might be based upon what you as a TA is funded to do, or that might be that you are able to assess different programs and the support that they need. Perhaps this program here in the middle, has worked hard, but really needs help along the way, needs more training in this. Their self-assessment results are lower, and you want to provide more intense TA, or you're able to. Well, this program here, once you get them, they've really proven that they can keep it moving on their own. So various levels of intensity. But we all move them all towards success. The next type of TA might be some sort of cohort. Perhaps you bring on 10 new programs in September and you move them through the year. Perhaps those are independently, but for you, you think of them as a cohort because they are the 2020 cohort that's working with Go NAPSACC. Perhaps you connect them more virtually through Facebook groups or other ways that you do have some connection between them, even though they might all be working independently. So that's a cohort working their way through Go NAPSACC over the course of time. Lastly, Go NAPSACC often supports any sort of group TA or collaboratives. Here in North Carolina, that goes through Shape NC or through the SEP's Farm to ECE collaboratives. That's when you bring people together with some sort of education component. So they come together for training, for support, to learn from each other about what they're doing to get more creative ideas. And then in between each of those learning sessions, they go back to their home program and they work on making their program, writing those action plans, taking those self-assessments, and moving them through the process with the support of the TA. So that's some sort of group TA or learning collaborative, most commonly is used in that format. We do have a group in another state that's working on bringing directors together just for a small evening discussion where they together as a group are choosing practices that they want to work on. So each program is working on the same best practices, but that way those providers in that local community can really support each other specifically in their work. So that would be a different form of group TA. So that's the first type of implementation that I wanted to share. Next is work using Go NAPSACC as part of the QRIS system. North Carolina, our Starr system. That's not happening in North Carolina, but I did want to share with you, since it is happening across the country. There are states where Go NAPSACC is a piece of their QRIS, where QRIS is including information around obesity prevention, child nutrition, physical standards, where they are requiring self-assessments or action plans as part of their QRIS. It's a way of updating training and education requirements for all of the providers. In some cases, QRIS is you meet the the QRIS standards in this area by being at a certain level on your self-assessments, by meeting a certain percent of that. In other states, they are simply looking at the fact that you've entered this field. So the fact that you are working on this area at all, no matter what level you've reached, they consider that success because you're entering into the area of looking at these standards. So it depends on the state, but to know that some states are using this as a piece of their QRIS. Something to think about in terms of Go NAPSACC and best practices, that our best practices or exceed all their standards are out there. So if you're looking at NACI standards, caring for our children, Head Start standards, the CDC's 47 obesity prevention standards, whatever standards that you are trying to meet, Go NAPSACC will help you meet those and exceed those standards. So I think that's important to recognize along the way. The last implementation model I want to share was looking at statewide intervention programs. So some sort of ongoing statewide recognition program where a child care program applies to be recognized for the work they've been doing in these areas around either specific standards or working towards specific child nutrition, activity, breastfeeding, farm to EC, or other areas where people have looked at statewide recognition and intervention programs. So there are two programs specifically in North Carolina that I wanted to highlight in this area. One is the Breastfeeding Friendly Child Care designation, which child care programs have and can continue to apply for, recognize for their breastfeeding friendly child care. So that's an option currently in North Carolina. Next is REACH, which stands for Recognizing ECE's Advancing Children's Healthy Habits. That is in creation mode right now. REACH is a partnership between Go NAPSACC, Wake County Partnership for Children, and SAFS out of NCSU. And so we to be working on creating a recognition program, REACH, that child care programs around all the work in healthy habits. So as I said, that is in creation mode. We are hoping to pilot this spring, but obviously that pilot has been delayed. But if interested, they can email me and let me know they're interested in REACH, and then we would be thrilled to have them get involved, especially right now. We are looking for more TAs to help pilot if you're interested. You can also email reachrecognition@gmail.com if you want to know more about that. Some of the ways that recognition programs work is someone would initially take a self-assessment. In this case, I've mentioned child nutrition, but depending on the recognition program, obviously in breastfeeding, you're taking the breastfeeding self-assessment. You're going through that improvement process, and then usually you earn some sort of recognition. It could be a bronze, silver, gold. The breastfeeding friendly childcare designation in North Carolina works on a block system, so you earn a certain number of block areas of your work. And we hope programs will continue to move their way up through that system to be recognized whatever their highest level is. But it's a way of letting childcare programs be honored for the work they're doing. It's also a way of letting families and the community know about the work you're doing. So to let families know that you have taken on this extra initiative and are working your way towards creating the healthiest environment you can for the children in your care. So that's what a recognition program looks like. Hopefully that gives you a little bit of ideas of different ways that Go NAPSACC can be incorporated into your implementation, knowing that you are using something that is evidence-based, which we know is important in all of our programs, that is evidence-based and that you can count on will move child care programs forward. So we see this as a piece of the implementation because it is a way to help move people along the process, to keep them moving in the same direction, in the right direction, in a healthier direction, so that it supports any of the work that you are doing as a TA, that it is a way of helping programs continue to move forward and look at themselves, be introspective, and continue to improve what they offer. So let's look briefly at evaluation. Since we know, I mentioned that it's evidence-based, we want to be able to help you see where you see those results. So within your consultant account, or if you're a state partner account, you are able to choose different types of reports, and you are able to see the steps a program takes you were able to see the steps a program takes throughout that 5-step improvement process. So you'll see our reports on each of the self-assessments, so you can pull down the results, as I said, for a group of providers on their self-assessment results. You're able to see what plans they've made, what action plans. So through either a detailed goals report, you can see the specific plan goals that programs are working on. Through a detailed activity report, you can see what goals they've chosen and which ones they've completed. The learn more. So when providers do complete the provider training that's on Go NAPSACC, there isn't a report for that here, but we do let our state partners know the trainings that have been completed by providers in their state. And lastly, keep it up. So that is when you see that second self-assessment result. You can see here, you can county that you want to get reports on. So if you're working with a local partnership, you can get reports just on your counties, or you could see for your whole state. Also, you can choose the date. So if you, Go NAPSACC's been in North Carolina since 2014, so you might want to pull reports just on your current cohort, just looking at 2020. And so you can, just a very brief, if you were a TA or a state partner, you would get much more extensive training on Go NAPSACC, but I just wanted you to see for each program, these are, I pulled from a North Carolina report, but changed names for a little bit of confidentiality. But you are able to see a child nutrition self-assessment, what % of best practices they've reached, their overall score on that self-assessment. If they've taken a second self-assessment, you see the date here. You see their new scores, so you can see any progress they've made. You can also see if they have open action plan goals and closed goals. So there's lots of ways that you get to check on where they are and what they're working on. If you want to see more specifically for self-assessments, then again, you can see exactly their answer on each question. So a 4 means they're meeting the best practice. A 1 means they're just starting out in that area. A 0 means they skip the questions. You get a lot of data here how people are working through Go NAPSACC. So we are at 9:20. I wanted to share with you a little bit about next steps, but I'm going to take a breather for a second and just ask people if they have other questions to add those to the, because I would love to be able to support people later. All right, let's look at next steps. Hopefully I have gotten you interested in learning more about NAPSACC. So I prepare steps thinking about TA consultants and then local partnerships or other agencies. I know there's at least providers on the session, which is very exciting. If any of those providers are new to Go NAPSACC register, feel free to email in the chat that you are a child provider and your email address, and I will get you. For those of you who are TA consultants or are representing other agencies, local partnerships, health departments, other agencies that might be interested in using Go NAPSACC, we do have a NAPSACC Nation News that is for TA providers and state partners. It's a way to learn about our trainings that are coming up for TAs, our monthly webinars that I'll talk about in a moment. And so if you are interested in being added to NAPSACC Nation News, you can write NAPSACC Nation News and your email address in the chat, and I can add you to our newsletter. For TA consultants, if you want to get involved more, there's a couple different options. We do offer monthly consultant webinars for TAs. Those are on the last Wednesday of the month at 1 p.m. The webinar in April was on physical activity in childcare and at home, since many people are at home right now. The webinar in May on family engagement. So those each month in NAPSACC Nation News, and that's where you register for those. If you want to move forward and get, and any consultant in North Carolina, even a Go NAPSACC TA, and if they haven't been trained as NAPSACC TA, participate in those webinars. So I encourage you to look for those. After those webinars end, the recording for them is included in the next month's NAPSACC News. Interested in getting more involved in Go NAPSACC and want to be trained as a TA consultant, then we offer monthly TA consultant training. It is done remotely, just like this session is being done. So you could do it also from your home if that's something that you want to take part in the future. It is up into a few different parts. There is a first part on the provider tools. So you learn definitely about what's provided for providers and how you can support them in their work. You then have an assignment. So as a TA, you would create a pretend account in that demo website so that you can practice and see what the experience is like for a provider. And then you come back together for a second part of the training that is on the consultant tool. So you would learn much more about support providers, about our guidance to TAs on how many goals people should be working on, when to do in-person visits, just a lot more support for you as a TA on how to get started working with providers. The next dates for our trainings are listed here in May and in June. To register for Go NAPSACC training, you can email me. And I ask anyone who's asking to be added to our newsletter, you include your email address, but also registration for the consultant training will be listed in NAPSACC Nation News. Once you are certified as a Go NAPSACC, then you can start enrolling providers. So that's what happens for TA consultants. If you're a local partnership or another agency that's interested in Go NAPSACC, first you have to decide how you want to use this as an intervention model, thinking about the staffing you have. Is this something that can be incorporated into the work that you already are doing? Perhaps you're already supporting childcare providers around nutrition or farm to ECE, or the breastfeeding friendly designation, and using Go NAPSACC would add to your work there, in which case you'd be adding it to your current staffing. Perhaps you need to look at adding additional staffing, thinking about funding for obviously that staffing, and we really encourage you to include any sort of incentives. And those can be very small incentives, whether those be financial, materials for programs as they're working on physical activity, providing them with some portable play equipment or other types of incentives, but it really helps encourage them along the way. And then obviously, as you develop your intervention model, thinking about what your target goals are. Once you have that, you would want to start training staff and doing outreach to enroll ECE programs. And that's a place where, again, I'm here to support you as a training and outreach for Go NAPSACC in North Carolina. So I encourage partnerships, other agencies that are thinking about using Go NAPSACC, want to talk intervention models and possibilities, please contact me. I'd be happy to talk with you more. So that's a little bit how to get started. So providers, if you're interested, you could reach out to me to start an account. If you want to work independently, I can also let you know if there's any TAs in your county that might be able to support you in your work. If you're a TA consultant or a local partnership, I encourage you to sign up for NAPSACC Nation News and get there. And learn more about us and possibly take part in our next training where you would learn much more in depth about Go NAPSACC. So lastly, I already mentioned, I think, most of these ways to get added to our email list. If you have questions, you can always email gonapsac@unc.edu. It's helpful if you mention in your email that you're from North Carolina, so that gets forwarded to me so I can support you there. If you want to discuss any implementation, you can always reach out to me directly. I'm at aviva.starr, S-T-A-R-R, @unc.edu. And lastly, I encourage you to follow us on Facebook and Twitter to learn more about our work and to share your success. So if you're a TA already using Go NAPSACC, please share your success with us. We'd love to highlight you on our social media or share the work you're doing on your own. And with that, I have managed to talk fast enough that we have 5 more minutes. So if people have specific questions, or Scott or Eric, if you've seen any questions that I missed, I'd be happy to answer those now, or else I certainly thank you all for joining me today. And I'm going to stay on the line for a while. If you have questions, feel free to share.
Thank everybody for coming to today's session. Thank you, Aviva, for a very engaging and a lot of good information. We did want to remind everyone that it is being recorded and that will go on our website as soon as possible. I feel like there was one other question that 4 Ps perhaps. There it is. Can you share the 4 Ps? I did see that. It's about the only other question that's not addressed.
email them to you as well, but the 4 I mentioned are provisions, what's provided to children, practices, the practices of the adults around you and how they influence these healthy habits, professional development, which is education and professional for children, families, and obviously for staff, and then lastly is policy. I also saw a question about certificates, which I assume training certificates from this session, which I assume Smart Start is taking care of.
I do not know about that, but I can find out for sure.
Great. Well, I'm just going to say thank you. And as I said, I will stay on the line for a bit more. People have more questions, and I really hope to hear from people. I love to hear about the work you're doing in your community and help you problem solve and brainstorm about